Good evening, everyone. This is Dr. Mike. Welcome to our YouTube channel. And to all the viewers, to all the followers, and to all the subscribers, good evening to all of you, or good day to all of you. Tonight we'll be discussing another important medication that most of our viewers are using. They keep on asking me what medication is used for allergies. So this medication is what we call Celestamine, and we would be discussing the uses and the possible side effects of Celestamine. So before anything else, please do watch this. To all the viewers out there, please watch this first as we move our discussion, or before our Yes, good day everyone. Welcome back to our channel, Health Talk by Dr. Mike. And if you're new here, please don't forget to like, share, and subscribe. You can hit that notification bell so that every time that we have a new episode, you'll be notified. And as I have mentioned, tonight we'll have a discussion about the uses and side effects of Celestamine. I want to ask our viewers watching tonight, if you have some allergies, have you experienced taking this medication, Celestamine? You can answer, you can put your comments on our chat box. You can chat us whether you have taken this medication, Celestamine, or not. Okay? So I think in my case, I've tried using this drug, Celestamine, when I had some allergies. But anyway, we'll start our discussion. To all the viewers watching tonight, thank you so much for joining us. Anyway, let's make the screen bigger, okay, so that you can see clearly. Okay, so as I have mentioned, we will discuss the uses and side effects of Celestamine. This medication is a steroid. Specifically, it's a corticosteroid, and it has an antihistamine properties. So, yeah, one of our viewers, Miss Precious Tabilin, mentioned that she have not taken this medication, not yet. Okay, so Celestamine is a combination of two medications, two drugs, a steroid and an antihistamine. Okay, so before we move forward to our discussion, let's discuss briefly what allergies is all about. Okay, because particularly the weather is becoming cold now in Hong Kong, and some people are experiencing allergies. Some may have this allergic rhinitis or some kind of allergies, whether food or due to the climate currently. So allergies, it means this would be the reaction of our body to a normally harmless substance. Actually, the substance commonly involved are the followings: pollen, molds, animal dander, latex, certain foods, and insect stings. Think about it. Were you exposed with pollen before? Molds, animal dander, latex, certain foods, and stings, insect stings. The allergy symptoms range from mild, rash or hives, itchiness, runny nose, watery, red eyes, to a life-threatening condition. So just imagine if you were exposed suddenly with the following factors that would trigger an allergic reaction. So some of us may be exposed to pollen, particularly nowadays because of it's kind of windy outside. So again, you might be having some kind of allergies. We will not discuss specifically the different types of allergies, okay, when you are exposed, but again, the medication, okay, particularly for allergies. So as I have mentioned, these are the symptoms for allergy. Some of you may experience cough, itchiness, runny nose, swelling, and then redness, itching, some blisters, some edema, some lacrimation, vomiting, and stomach upset. So these are the common allergies or allergic symptoms that our patients may experience. But what are the causes of allergies? Okay. The causes of allergies you can identify. I think some of you may have some allergies on specific causes. Like, for example, pet allergy. Some of you may be allergic to the hair of some animals, particularly dogs and cats. Then we have common, particularly at the house. Some of our domestic workers, our friends, have been suffering from dust mites. That this may a small insect that may cause some allergy. Pollen, particularly if you're exposed some pollen when you are outside. Then moldy allergy, vaccine allergy, drug allergy, particularly some antibiotics or paracetamol or some NSAIDs, mefenamic acid or paracetamol. Some individuals are allergic to it, or penicillin. These are common drug allergies. Sun allergy, food allergy, particularly eggs, peanuts. Then we have chemicals allergy or chemical allergy, particularly those using some disinfectant. Okay. And then virus. So there's such thing as viral allergies. Okay. So moving forward, so Celestamine is a medication. As I have mentioned, is a combination of two medication, two drugs, is a product that contain two drugs in one. So this drug, Celestamine, contains betamethasone, which is a steroid, a corticosteroid, and dexchlorpherinamine maleate, which is an antihistamine. So remember, histamine is released in the body, particularly in the skin area. So that's why once you were bitten by an insect or exposed to some allergen, you will feel very itchy. Okay, because the histamine released from the mast cells, and then sometimes you would feel some kind of itchiness on your skin, and the moment that you would scratch your skin, the time that the histamine would be released on your skin. Okay, uh, so we need to control this. So that's why we are taking Celestamine. But the most important here is, what are the uses of this drug, Celestamine? So Celestamine can be used for individuals, for our patient who have allergic reaction, particularly if you have runny nose or rhinitis. So allergic rhinitis, you can use Celestamine. Another uses of this medication, Celestamine, is once you are having asthma or respiratory problems. So we can use Celestamine for respiratory problems such as asthma, as an example. Okay, particularly for individuals who have skin problems, particularly if you have eczema or dermatitis or any dermatologic condition, Celestamine can be used. Okay, so for our OFWs here, asking what medications can you use, particularly if you have some eczema or some allergic reaction, or for example, you have dermatologic or skin conditions, skin problems, dermatitis, you can use Celestamine. Okay, moving on. How about the side effects? For those individuals taking Celestamine, and you should know this, that whatever medications that you're taking in excess, so meaning you are taking more of this medication, or you are trying to take this medication from time to time, this may lead to some side effects. What are the side effects? Okay, what are the side effects of this medication, Celestamine? Celestamine would increase risk of infection because it is a combination of steroid and antihistamine. Prolonged use of steroid is not good because it increases the risk of infection. Okay? It would also weaken your immunity. Just imagine you are taking medications for allergies, and then your immunity would go down and you have an increase in certain infections. Okay. Second one, the side effect of Celestamine is you might be prone to fluid retention or edema. It means swelling of your legs. So some of our viewers, some of our OFWs who are taking this medication, Celestamine, be careful. Overdosage or prolonged use of this drug, Celestamine, can lead to swelling, particularly the legs or lower extremities. Another one, another side effects of Celestamine, patient is prone for corneal thinning. Okay, so you might be having problems of your cornea. Also, another side effects would be an increased risk of bruising. Some of our viewers, some of our patients, okay, they've been complaining of bruising. After a series of tests and after a complete history and physical examination, patient would inform the doctor or the physician that they've been taking Celestamine for a prolonged period of time. And since they are taking this medication, Celestamine, for a prolonged period of time, they may have this increased risk of bruising, and some patient may experience body malaise. So again, to all the viewers out there watching tonight, some of our OFWs been experiencing this kind of side effects. Please, if you have these side effects, stop taking this medication, or you only take these medications once you have the allergies. Do not take this medication just like any other vitamins. This medication, Celestamine, is not a vitamin. Okay? It is not even a prophylactic medication. You could only use this one once you have allergies. Once you don't have the allergies, stop it. Stop the medication. Okay? Another one, another side effects of Celestamine is production of ulcer, or you are prone to having ulcer. Weight gain, so patient may increase the weight, or some patient may have to have osteoporosis. So just imagine the possible side effects of Celestamine. Okay. Another one is some patients are prone to have mood disorders or depression. Okay, some may have anxiety attack once they've been taking Celestamine, or trouble sleeping. So again, some of our viewers have been asking, they've been taking this medication for a prolonged period of time, and then they've been complaining that they have problems in sleeping. They cannot sleep early at night, or sometimes they have insomnia. And then when you investigate, when you ask them during your medical consultation, during your physical examination, and then your history taking, some patients would inform you that they been taking this medication for more than 6 months or more than a year. So every time that they have these allergies, they keep on taking this medication, and sometimes it's overdose. Okay, so moving on, in terms of the side effects of this medication, we also have, aside from mood disorders, remember this, mood disorders can contribute also to one of the side effects of this medication and troubled sleeping. Another one, patient may have adrenal suppression. So in terms of kidney, okay, visual disturbances such as blurring of vision and glaucoma. So there would be some increase intraocular pressure of the eye. Okay, so it might lead to blindness, or it might lead to blurring of vision. So be careful in taking this medication. Again, for kids, for children, they may have stunted growth in children, or in very rare, this is very rare case, that they may lead to some anaphylactic reaction or severe allergies. Just imagine you are taking this drug for allergies, but there's such thing as an allergic reaction coming from this drug as one of the side effects. And this side effect would lead to anaphylactic reaction. So there would be a generalized allergies. So there would be some problems inside or outside your body. So if you've been experiencing this anaphylactic reaction, okay, moving on. Remember that Celestamine contains ingredients that can increase drowsiness. So this medication can lead to drowsiness. Okay? Do not take this medication with alcohol. okay, as it can increase the severity of drowsiness. We are advised, or we are trying to inform our patient as well, or clients, that avoid driving or operating machinery while taking this medication, because it should be taken with food as well, because you might be sleepy during driving or when you are operating machinery. So be very careful once you are taking Celestamine. There are other medications that we could use for allergies. However, this medication, because it has a steroid, so the effect would be very fast as compared to the other medication. But again, it's a discretion of your doctor on which drug that they would prescribe you if you have some allergic reaction. Okay, because some of our viewers have been asking what is the most important, or what is the most effective drug, which one is the fastest one. It depends on your condition. Okay, we would be discussing the other antihistamine medications, particularly those medications that would not induce drowsiness or sleepiness. Okay, because there are some medications who would not induce these kinds of things, particular drowsiness. Unlike for this one, Celestamine, because it has a steroid, and the antihistamine effect, it would lead to, particularly if you've been taking this medication for a prolonged period of time, sometimes you feel sleepy when taking this medication. Okay? Again, the bottom line here is be safe and be healthy. And if you have some allergic reaction, please do visit your doctor so that your doctor would give you the exact medication, the medications that would tailor made for you, particularly to your specific disease entity. If you may have an urticaria, if you have any other allergic reactions such as hives or asthma or any other things, any other allergic reaction, always consult your physician, because your physician could examine you clearly, do a physical examination, history taking, and suggest to different kinds of tests before taking medications. Because this antihistamine, sometimes they are over-the-counter medication, so people can just buy it without a prescription sometimes. But again, be very careful in taking this medication. At least tonight, we've discussed the uses, the possible uses of this medication, Celestamine, and also the possible side effects. Not all people taking this medication would experience the side effects. Some may experience the side effects, particularly in higher doses or for using this medication for a prolonged period of time. Not always the case that you may have the side effects. So be very careful in taking Celestamine, particularly nowadays because of the weather changes, etc. You need to visit your physician so that your physician can guide you and can prescribe you the appropriate medication specific for your condition or allergic reaction or allergic problems. Okay? So once again, this is Dr. Mike. I hope that you learn another thing regarding our episode tonight. Watch out in our next video because we will be discussing another health talk for all of you so that you would learn related to health. And if you have questions, feel free. You could just write your questions on the chat box or after this live episode. And if I have some questions, I would answer them. And if you missed the previous episode, you can go back and you can check our library for the different topics. I think I have a topic about allergies specifically and allergic rhinitis. You can go back and then you can check as well. Okay, so that you would learn new things all about allergies or different health topics. So once again, thank you so much for all the viewers. If you're new here, I am Dr. Mike based in Hong Kong. And don't forget to like, share, and subscribe. And see you again in our next episode. Thank you so much and have a great evening, everyone. Bye-bye.